Welcome to this explainer. Okay, let's dive right into this. Because today, we're looking at something you literally see every single day, but probably never really observe. We usually don't give them a second thought, but our nails are practically tiny diagnostic monitors attached right to our fingertips. They're constantly sending us warning signals about our health. Now, most of the time, those signals are just harmless background noise, but occasionally, a few of these visual cues can be urgent, flashing warning signs about your heart, your lungs, or your skin. Today, we're going to decode those signals.
So I want you to actually hold up your hands right now. Yeah, go ahead, bring them right up to eye level. Take a good close look at your nails. As we go through these warning signs today, I want you to actively compare your own nails to the markers we're discussing. Now, some of what you find might actually sound a physiological alarm, but hey, don't worry, a lot of what we cover is going to completely reassure you about those weird little lines and ridges you've probably always wondered about. You ready to do a quick physical test?
All right, let's do this together. It's called the Shamroth window test. Step 1. Hold your index fingers together, pointing away from you, with the very tips touching so the tops of the nails are pressed back to back. Got it? Okay, step 2. Look right at the base of the nail beds where they meet. You should be able to see this tiny diamond-shaped sliver of light shining right through the gap between the nails. Do you see it? Because if you do, that is a perfectly normal baseline. If that gap is missing, however, well, keep that in the back of your mind, because we are going to reveal exactly what that means a little later on. To keep things actionable, we've organized all this information into a simple triage system. Green flags for what's completely normal, amber flags for your health timeline, and red flags for when you absolutely need to see a doctor ASAP. Let's kick things off with Section 1, green flags. These are the completely normal things that honestly cause way too much unnecessary panic. You have almost certainly had little white dots on your nails at some point. And I can practically guarantee someone told you it meant you were deficient in zinc or calcium, right? Well, that is a complete myth. The medical truth is actually super simple. It's a condition called leukonychia, and it gets a massive green flag. Those harmless white dots are usually just tiny air bubbles that get trapped in the nail after some really minor trauma. I'm talking about something as small as knocking your finger against the desk or maybe a bit of light nail biting. They are incredibly common and absolutely nothing to worry about. Next up, we have vertical ridges. A lot of people notice these prominent lines running all the way from the base of the nail down to the tip. Again, you can breathe easy. This is another total green flag. See, our nails are made of a protein called keratin, and as we get older, that keratin simply gets wrinkled in the exact same way your skin wrinkles as it ages. These lines just form naturally over time. They are definitely not caused by vitamin deficiencies, no matter what internet rumors you might hear, and they absolutely do not signal disease. Wrapping up our green flags, we have the lunula. If you look at the base of your nail right now, you'll probably see a pale little half-moon shape peeking out from under the cuticle. A surprising number of people stress out about this shape, worrying about its size or its color, but by definition, the lunula is just a completely normal, entirely harmless anatomical feature. It's just a regular body part that happens to look a little different from person to person. Seriously, nothing to stress over. All right, moving right along to Section 2, amber flags, or what we call the timeline. And this brilliantly illustrates how your nails act as a physical, historical record of what your body has actually been through. 3 millimeters. That number is the absolute key to decoding this timeline. On average, human nails grow by about 3 millimeters every single month. And because they grow at this very predictable, steady pace, your nail bed essentially transforms into a biological clock. Let's map out how this timeline actually works. Because of that 3 millimeter growth rate, the base of your nail represents roughly 1 month ago. The middle of your nail, that's about 2 months ago. And the tip is around 3 months ago. Have you ever noticed a horizontal dent running across your nail? Those are known as Beau's lines. Now, they aren't inherently dangerous, but they are incredibly informative. If you see a dent halfway up the nail, it means that something interrupted your nail's growth exactly 2 to 3 months prior. It could be a high fever, a major infection, a surgery, malnutrition, or even chemotherapy. All of these systemic shocks leave their mark. It's just like finding scars on a timeline. Now, let's talk about splinter hemorrhages. These look like tiny, thin, red or black lines trapped right under the nail, literally like a little wooden splinter got stuck in there. Context is everything with these. If you spot this on just one single nail, it's generally harmless. It usually just means you had some local trauma, like maybe you pinched that specific finger in a drawer, which caused tiny blood vessels to break. But if you start seeing these splinters across multiple nails, the diagnosis totally shifts. That can indicate broader circulation issues, and rarely, in the right context, it can point to heart infections or autoimmune problems. Another really common amber flag is a fungal infection, which leaves nails looking thick, yellow, distorted, and kind of crumbly. You usually see this more on toenails, for sure, but it absolutely happens on fingernails, too, often after an injury, prolonged exposure to moisture, or because of immune issues. The reason this stays an amber flag and doesn't escalate to a red flag is that while it is unsightly, very stubborn, and honestly just a bit ugly, it isn't fundamentally dangerous to your life. You can treat it with antifungals, or in some cases, just leave it alone.
Now, what's really fascinating here is how your nails can tip you off to conditions happening on completely different parts of your body. Nail pitting looks exactly like it sounds, like someone took a tiny pin and made dozens of little dents all across the surface of the nail. This happens when the cells that actually manufacture the nail get disrupted. Just 1 or 2 pits? Usually nothing. But lots of pits? That is an amber alert. It's heavily linked to systemic conditions like psoriasis, eczema, or alopecia areata. It's just the perfect example of the nail acting as a mirror for your overall systemic health.
Dr. Quinn, from our source material, used this incredibly vivid imagery that really stuck with me. Just imagine the surface of your nail curving inward so much that you could carefully place a tiny droplet of water right in the center and it wouldn't even spill off the sides. Medically, this condition is known as koilonychia, or more simply, spoon nails. And the contrast is striking. A normal nail is strong and gently curved right over the top of the finger, but a spoon nail is thin, uncharacteristically soft, and actually curves upwards at the edges. While it's not an immediate emergency, it tells a really vital story. This specific upward curve very often happens because of an iron deficiency in the body. So if this is a new development for you, it's a fantastic prompt to go and get your iron levels checked out by a professional. We're wrapping up our amber flags with a habit a lot of us know all too well: severe nail biting. Look, light biting might be a green flag, but when it gets out of hand, it definitely warrants an amber alert. It's frequently a physical indicator of underlying anxiety. But beyond the mental health aspect, frequent severe biting causes real physical damage. It invites minor infections, and crucially, if you bite down far enough to damage the cuticle and the nail matrix at the base, you can actually halt the nail's growth forever. Okay, we're going to slow the pace down significantly here for Section 3, red flags. If you see these markers, it means you need to see a doctor immediately. Think back to the very beginning of this explainer when we did that Shamroth window test. If you held your fingers together and that tiny diamond gap of light was entirely gone, and instead your nails looked bulbous, remarkably shiny, and rounded over the edges, that is called nail clubbing. Now, while it can sometimes just be a natural family trait, new onset clubbing is a major red flag. It happens when the body is actively struggling with low oxygen levels. This can be a direct signal of severe lung disease, COPD, lung cancer, heart failure, and sometimes even liver or inflammatory bowel disease. It requires immediate medical attention. So the crucial point here is this: if you ever see a dark streak, usually black or brown, that starts right at the base of a single nail and actually begins widening as it grows upward, this is an incredibly rare but absolute red-hot alert. That widening dark streak is the primary visual symptom of subungual melanoma. It's a potentially very aggressive form of skin cancer that occurs directly under the nail bed. It can start out looking just like a thin line, but it noticeably widens from the nail matrix at the base. It looks completely different from the harmless, thin little splinter hemorrhages we discussed earlier. As the doctor in our source material strongly emphasizes, early detection of subungual melanoma is absolutely critical. You simply cannot ignore this one. Because of just how aggressive this specific cancer can be, catching it early through visual identification makes a massive, massive difference in the outcome. If you or anyone you know has a nail that looks like that widening dark streak, a trip to the doctor is mandatory. We've seen today how something as small and seemingly simple as a fingernail can reveal just a stunning amount of information, from harmless air bubbles and timelines of past fevers, all the way to silent alarms for oxygen deprivation and skin cancer. Your nails are deeply, deeply connected to the rest of your internal systems. It really makes you realize just how communicative our biology actually is, if we just know how to look for the signs. Which leaves us with one final thought to ponder. If your nails are keeping a physical record of your health, what else is your body trying to tell you?